Hi, students. It's us again. So I wanted to tell you a little bit about Manual Edema Mobilization, MEM. This is a technique I actually learned in a continuing education class, and it's a manual technique. You use your hands to try to reduce edema in your patient. It's good for people who do not, it's good for people who don't have damage to their lymphatic system. So like people who you would rule out would be people with like lymphedema or some sort of actual damage to the lymphatic system. Maybe they had breast cancer and they had radiation. Maybe they had lymph nodes removed, which takes a piece out of the system. There's various conditions. We're going to talk about that more in the future. But this is for people who just have plain old edema and they need it to be less. And so I'm going to show you just kind of little pieces of what it's like. If you really are interested in this, I do teach this technique in my modalities class, which is in the summer. And so we take a lot of time to go through the various steps because it is a process that takes about at least 15 minutes to do on a patient. So to start out, we would be doing things to generally reduce edema in the middle of the body. So like we'd be bowing to each other. I want to hit your head. Okay, we'd bow several times and things like that. And then what I would do is I would move to her affected side. If this was her, left side would be affected. And I would start to do these gentle circles. Okay. And the idea is to do these circles over areas where there's a lot of lymph nodes. So like there's a lot of lymph nodes, anterior deltoid and posterior deltoid. Then there's a lot like in the, right by the medial epicondyle, like just proximal to that. And so basically what you do is you move down the arm in these different points, and then you do these gentle circles, very light on the skin, and that actually reduces edema. And I find this to be super effective for my outpatients. So if you are interested in that, please do take my my class, the modalities class, and we will talk about details for how to do that.